So you've Googled your symptoms, you've read up about it, you even called Aunt Betty, and you think you have a peptic ulcer. What exactly is it? Well, let's take a look. Hey, it's Dr. Klamaka with The Daily Doctor. Today we're going to be talking about a very common problem, peptic ulcer disease. So here we have a drawing of the stomach. The stomach is where digestion really begins to ramp up. Digestion actually starts all the way up in your mouth, but it really ramps up here in the stomach. As you can imagine, the tissue lining the stomach is very hardy because it's a highly acidic environment. Here we stylize the layers of the stomach lining. The issue with ulcers is either a hyperacidic issue or low defense issue. So either or, okay? If you have an imbalance, what begins to happen is the topmost layer begins to get eroded slowly but surely. And this is what causes your symptoms of pain, nausea, vomiting. In very advanced cases, especially if they're lower down here, it can even cause early satiety. That's getting full faster, and even bloating of the stomach because it can cause an obstruction over this area here. If you had a hyperacidic environment, you can certainly have reflux type symptoms. You can have heartburn, especially if the acid has no place to go. It'll try to escape somehow. GI bleeding, which in this case would present as dark, tarry stools, can also be a presenting symptom. As you can imagine, as this layer begins to get eaten up, the problem just builds on itself. Whether, again, it be from high acidity or low defenses, the problem just continues to build on itself. So, Doc, what are some things that can alter or cause these imbalances? Well, one of the most common causes is a bacteria called H. pylori, which your physician will likely test you for. Things that can alter the defenses include NSAIDs, smoking, alcohol use, as well as steroid use. So Doc, what should I expect in terms of treatment or management? Well, for most ulcers, your doc is probably going to start you on a PPI. That's a proton pump inhibitor. What these proton pump inhibitors do is they decrease the acid being secreted into your stomach. Now, it's important to remember that with PPIs, these take time to work. It's not like a Tums where you take it and it neutralizes the acid. These kind of work at the source to really decrease the acidic production. Most treatment regimens will last at least 2 to 3 weeks, so you want to be using your PPI every day for those 2 to 3 weeks. Apart from the PPI, your physician may also, at that initial visit, test you for H. pylori. Other physicians like to do the trial of PPI first, while others just test you for the H. pylori because it's pretty common. So if you pop positive for H. pylori, your physician is also going to start you on 2 antibiotics. Again, you want to be taking those medications as prescribed. Finally, one of the most important things with ulcer management is risk factor management. You really want to be cutting down on your NSAID use, your ibuprofen use. You also want to be cutting down on your smoking, and you want to be cutting down on your alcohol use. A majority of your ulcer symptoms should resolve with those 3 things. Again, that's a PPI, antibiotics if you have H. pylori, and stopping NSAID use. However, for a subset of people, their symptoms will persist. If they persist, your doctor will likely order or perform an EGD next. An EGD is when they put a camera or a scope through your mouth to look at your stomach. That's just to make sure that there's nothing funky going on. It allows us to look at your stomach. It allows us to look at the ulcers, what they look like, and even grab some biopsies. They may also grab additional labs and even some other imaging like a CT scan. That's just to rule out any other pathology or any other diseases. So here's the quick down and dirty of what we talked about today. Peptic ulcers are very common in the United States alone. There are over 100,000 new cases every year. The most common presenting symptom, which happens in 80% or greater of patients, is epigastric pain that's related to meals. Again, the epigastric region is the area above your belly button. The management options usually consist of a PPI, with or without antibiotics, depending on your H. pylori status, as well as risk factor reduction. And finally, further interventions, even surgery, may be needed if your symptoms do not improve with this conservative management. Well, there you have it, the basics of peptic ulcer disease. We certainly hope that this was a helpful and an educational video for you. Again, if you have any of these symptoms, make sure you see your doc. For the Daily Doctor, I'm Kevin Climaco. Stay healthy out there.